Most hernias appear in the groin or along the middle of the abdominal wall. The groin hernias are called inguinal hernias, and the middle of the abdominal walls are either called umbilical hernias if they're at the belly button, or ventral hernias if they're at an old incision or another little defect in the muscle or gristle of that abdominal wall. So pain from hernias can be anything from zero, where people just have a bulge that they're worried about, to most common is moderate, where people say, boy, I really notice my groin hurts or my belly button hurts when I'm bearing down, or after a hard day of lifting, or after sexual activity, to the extreme where people worry about this, but when it's obvious, and you're in the ER because you'd rather die than not have surgery. It can be terrible. So hernias do not always hurt, but when they hurt, that is an indication that they probably need to be fixed. Recovery time from hernia surgery varies a lot depending on the size of the operation and where we're starting at in terms of the patient's frailty. If you're a strong, healthy person and we fix a small hernia, you may be back to most of your normal activities within a day or two. Now, if you're a competitive athlete for money, you're going to notice longer than if you're mowing the lawn. But certainly some hernia repairs can take people out of action for weeks to months. Little kids tend to go to pediatric surgeons for their hernia repairs when they're toddlers or younger. Other than that, even into your 90s, hernia repair is an option if it's impacting your life. Women definitely can get hernias, and in fact, women can have a higher risk for certain types of hernias of having bowel blockages and truly having emergency operations. Most people are able to go home the same day as their hernia surgery. Obviously, with big hernias or really sick people, we keep them around longer. I think one of the biggest fears people have about hernia surgery is that there's going to be a large, obvious scar. We usually can make that pretty minimal. Another fear or misunderstanding is the degree of risk that people have for going to sleep for surgery. Anesthesia is relatively incredibly safe. Fertility changes after hernia surgery are almost completely unheard of after belly button or ventral hernias. With groin hernias in men, there very rarely can be changes in fertility. Sexual activity after surgery can be restarted in days based on your own comfort. The thing that makes people the most nervous about surgery is the fear that if they talk to a surgeon, they're obligated to have surgery. Talk is cheap. Come in, let's talk. Let's look at your situation, and maybe you'll feel a lot better about whatever your decision is. Whether or not to have surgery is a decision best made after consultation with your team, with all the cards on the table, so that you can make a decision with our help.